Good morning, good afternoon, good evening, and good night from all corners of the globe. I am your host, Michael Swigert, here on the New Human Project podcast. For the first episode, we will be discussing the psychosocial effects of pain, what causes and contributes to our pain, and how to overcome these obstacles ourselves and with the help of clinicians and those in our social sphere. Today I have with me Dr. Jacob Templar. Dr. Templar is a doctor of physical therapy and a fitness and rehab coach. He is also a practicing strength athlete in the sport of powerlifting, and he uses his extensive knowledge on pain and rehabilitation in both his clinical practice and in his coaching. However, there is a disclaimer. This media is not medical advice. If you have a health-related problem, please seek a medical professional. This serves only to educate people on the subject of pain and its relationship to psychosocial factors. Hello and welcome to the first episode of TNHP.
Thanks for having me on. I'm excited to be your first guest.
So tell me a little bit about your background and how you got started in physical therapy and coaching and things like that.
Yeah, so I have a pretty generic story of like why I got into physical therapy. Family member got hurt. I think my mom had like frozen shoulder, and I went with her to PT one time, and then like I played football in high school. Uh, Dealt with some like fairly minor injuries. I went to PT for that, and they got better. Um, was into weightlifting because of football. Like I played football, then pretty much just weight trained it all off season in the summer and stuff. And my mom said that physical therapy was a good field to get into, so I went to school for it. And then it just so happened that I liked it, and during that time developed a um, love for like physical fitness and nutrition and all those kind of things. Starting to get more involved with like eventually like looking more into the evidence-based area because I've always been like a curious person. And even before I was really super into fitness and stuff, I actually really started to enjoy psychology when I was in school, in my general education. And my bachelor's degree is in what's called health studies. It's very generic, like pre-health sciences degree, but it really heavily emphasized like I had to take Psych 101, interpersonal communications, group dynamics, interviewing and processes, like all these different kind of psych and sociology classes. And that was always very fascinating for me as well. And then during that same time period is when I started really getting into more fitness because of people like Eric Helms and Matt Ogus and Lane Norton. And my bridge to that was actually Jim Stepani of all people. And back in the bodybuilding.com days. And then it just really picked up from there because I've always had natural curiosity for learning. And so got into more evidence-based practices, learning about that, graduated from Utica College in 2016, started working, and then I've just kind of steadily evolved from there, to the point now where I'm doing actually a fellowship. And the emphasis of this is on developing skill set to have more integrated biopsychosocial practices in physical therapy in what's called a process-based approach, which is more of like the new cutting edge wave in psychology, which is part of their third wave of cognitive behavioral therapy and stuff, where like people like Stephen Hayes and Stephen Hoffman and Siriachi, I always forget how to say his name too, are working on developing like using machine learning and stuff like that to better personalize care and things to patients. And the group I'm working with is trying to take that lead and bring it into like physical therapy and just general physical rehab, whether it's like chiro, osteo, PT, whatever it is.
In your own words, could you
Mhm.
describe to your best of your ability what is pain?
It's tough because there's an argument of is it a perception or a sensation, and largely it's actually more of a it's more of a perception, just like how your like thoughts, emotions, and things like that would be considered like it's an internal experience. So it's really an experience that emerges from your individual experiences through your whole life, and also what all your body systems are like currently doing or at or and it can be influenced by your genetics, past experiences, current health status, where you are, even what's going around you that is the result of that. So it's really a complex interaction between all of our senses and current and past experiences.
That's very interesting because I feel like at least my perception of pain before we started talking was more so that pain was an indication of injury. The pain
Mhm.
was not necessarily this as complex as you say it is, but it
Yeah.
seems like there's a lot more factors that affect pain and how we feel, not just,
Mhm.
oh, maybe something is hurt in my body. Maybe there's a little bit more to it.
Yeah. And that's usually the case because like there's definitely several instances like you can like I used like to use stories to tell this stuff because it's much more relatable. But there are several and tons of instances where like in one of the articles that we discussed for some background for this it's called The Function of Pain, and it's kind of a philosophical study, and it talks about the evolutionary aspects of pain and how it was selected for humans. Is that it doesn't actually function well to tell you about damage to your body, because in most regards we should have high levels of pain actually, or we usually do experience high levels of pain usually prior to an injury, so like leading up to injury. And then oftentimes when we have the most catastrophic injuries, individuals feel very little or no pain, to the point where like there are several documented instances all through when people started looking at this in the 40s, 50s, and on, where in emergency departments, like huge numbers of, I think it's anywhere between like 30 and 50% of people who came in with like, entire limbs missing or things like that, often reported having very little pain. You can see instances where like there were other reports given from like the Yom Kippur War, where individuals had like grenade wounds or gunshot wounds, and they had no pain and really felt more like grief or anger or things like that related to like um, what was going on at the time. And even there's documented cases. There was a one of the best articles I've read in mainstream media about pain. I think it was from like New York Post or New York Times, and it was called like, "If Pain is Opinion, How Do We Change Our Mind?" And it gave examples of um, uh, field surgeon notes in World War II, where I believe it was like in Denmark or one of the Scandinavian countries, where American soldiers, were coming back to the field hospitals with like very grievous injuries, like as we see in a lot of the TV shows and movies and things like that. And they were more likely to ask like nurses and people there for cigarettes than they were for morphine. But then what they noted is that people that lived in the area also would experience actually much higher levels of pain with these injuries. And what they surmised by ending up talking to these people and like figuring out what their experiences were is that for the soldiers, being injured was like a sign that you were safe now. You would get away from all these things that were so traumatic and troubling for them, all the horrors of war, because they got to go home. They would go back to America, which was not an active war zone. They would either be there or, back to England. And the people, though, that were civilians or soldiers for the resistances and things like that, that was their home, like where it was being destroyed and where it was so dark and bleak. And you can see the same thing even when we study like modern media. Like if you look at like how they talk to Americans that came home after the war and what their perception of the world was, and in general, in most parts of Europe, things were very positive, depending on which like side you were on, because of where they were living and what was going on, and things were advancing. We got rid of fascism and all these other evil things that were happening. But then we can look at like the media that came out of that, right? It's very happy-go-lucky, white picket fence and everything. And then something that both you and I share a passion for with anime is you look at anime, and one of the first anime that came out was Gundam. And Gundam is all about like the horrors of war and how bad war is and how bleak the world is and just the devastation and like world destruction because the Japanese experienced nuclear weapons being used on their cities and firebombing and all these other things. And you can see that in the depictions of like what were very popular animes, even like Vampire Hunter D and Berserk took a lot of themes from those early ones of like just showing like these are horrors of things that happen and traumatic experiences. So it's just interesting how that shapes then people's perspectives and what happens in their reactions and things like that. So a lot of a tangent, but hopefully that was good information.
No, that's really interesting stuff there. And to circle back to the idea of pain, the things that happened in World War II, where you say these soldiers, maybe they're losing limbs or something like that,
Mm-hmm.
but they're not I'm sure they're experiencing some level of pain. I mean, I've never lost a limb myself, but I'm sure that
Mm-hmm.
it's still extremely painful. But it's interesting that you say they feel more safe because they know that they get to leave this place and they get to go back to somewhere, the white picket fence home. They don't have to worry about still fighting a war. So I think that's a really good correlation between your environment and how that affects your perception of pain. And it's
Mm-hmm.
really quite the opposite from this is probably a generalized statement, but it's quite the opposite from what I and I'm sure a lot of other people feel that
Mm-hmm.
pain is a clear indication of injury.
Yeah.
Whereas it seems like you're saying there's a lot more things that contribute to that.
Yeah. And I even use examples of like, well, if pain always meant injury, then like when you got a headache, right? And everybody can kind of experience like, oh, I experienced a headache or even like a brain freeze. Like, did you actually damage the inside of your mouth when you get a brain freeze or your sinus or like your headache? Is there something wrong with your brain or like a stomach ache? Same thing. These are all indications maybe something is going on that needs you to pay attention or change your behavior or things like that.
Yeah, it would be pretty crazy if we had to get a neurosurgeon for a brain freeze.
Yeah. So you can see that like there's many examples that we experience like even day to day where um, we have pain, but there's no reliable indication that there's damage associated with said pain. What generally happens is that this term of what's called nociception is conflated with pain. So because we view things a lot of times very mechanistically, rather than from a context perspective as a worldview, like we're a machine. So whenever a machine gives you a sensor, it usually means that something is wrong or about to go wrong. Um, but machines are really kind of cheap imitations of what biological organisms can do. And but when we look at that, so nociception is how your body and your tissues always kind of constantly sample the environment that you're in and status of tissues. And so that process is always actually on and has to be sending signals. But like how annoying would it be if all the time, like say, you were constantly aware of, say, like your t-shirt touching you, like having full conscious awareness that the entirety of everything you're wearing or touching is touching you. That's not beneficial. That's kind of gets in the way of a lot of cognitive abilities that we have. So our body learns how to automate certain processes. So when people say like we only use 10% of our brain, what if we use the full thing? Well, we do use our whole brain for continuous um, purposes, but we only probably use about 10% of it for like our conscious awareness of things. In the meantime, everything else is being like filtered and, constantly taken out. And that's why like the other experiences, like you can't constantly taste your saliva or even the air or, smell the inside of like what your skin smells like. You have white blood cells that are in your eyes that we don't constantly see. And even like in our ear, there are blood vessels and, it's close enough to your heart where you should be able to hear your heartbeat. You'd also be able to hear your jaw moving, things like that. But it's stuff that our nervous system learns is irrelevant information. and you do not need conscious awareness of that. So it's become very good at doing these things, and because we're always constantly sampling, what can happen is there may be certain factors involved with like your current biological state, your psychological well-being, or just lack of good social, support or health, that could make your body start filtering these information differently. Um, for some reason, it may think that it's being helpful and useful.
So we're humans, not machines. We're two separate things.
Yeah.
How has our understanding of how to treat pain changed?
So it's gotten a lot better. It's still not kind of where I think it should be necessarily. It is much better in some places than others, and it's dependent on even like what provider you've seen and like how educated they are. But we've gone from, I mean, if we go way back, like to ancient times, they used to think that you need to like balance humors, and it was based on foods you ate and different things like that. I think in general, we've known that like movement and things like that have been good for health, but that has also changed in a long period of time, because definitely you could see where it circled back around with like World War II, World War One, where there was still this overwhelming idea of like most ailments required like bed rest, things like that. And then in the 70s and 80s, we started to figure out that's not so good for a lot of people. Even now, we're trying to get rid of some of those things with like back pain and troubles with pregnancy and different things like that. Um, so it's still held strong over the period of time of a general mechanistic machine like based approach to the human body, which has persisted kind of since like probably around the 1600s with Rene Descartes. Um, I mean, he was doing the best of what he could at the time, and his philosophies actually get much more nuanced and further than that. But because medicine isn't necessarily exposed to those things, and we kind of you'll hook to something, what happened is like it's still viewed very much still in his ways of thinking of like that pain must be a signal that something is broken or wrong. But if that were true, then we would see 100% success rate with like all surgeries, all injections, all medications given, things like that. So we know that's much more complex than that. And we're starting to get better at understanding these things, but there's still, I don't think, a very good model that currently exists or is widely used that can then individualize that a little better with understanding these complexities and how it might influence like what treatments we maybe should be administering, or things we should be like targeting with that person.
So there's still a lot that we don't know.
Yeah. I mean, I think on average we think we know a lot more about the body than we really do. I mean, even in psychology, where they've done thousands of papers, and specifically like looking, there's been advancements. We still don't quite understand like the best current understanding of even like why everybody has some sort of like spectrum of emotion or intrusive thoughts and negative thinking, is that it has to do something with evolutionary selection. Mm,
You mentioned that you do a lot of PBT, or that you're focusing more on PBT, which is
mm,
process-based therapy. I
yeah.
want to take a step back from that and start with
Mm,
CBT. Can you
yeah.
describe CBT and then compare that to PBT?
Yeah. So like cognitive behavioral therapy is kind of like the grandfather of kind of modern psychology, with like um Stephen Beck was like the founder, and then it's led into like it's gone through three different distinct waves now, where in the third wave is more like blurred lines between a lot of things. So original cognitive behavioral therapy was focused on like reducing symptoms and like kind of looking to change or replace like what was considered like problematic behaviors or thoughts or cognitions, like different things like that, with new, you could think of it as like new schemas, is what you would say, or like new experiences, thoughts, behaviors, things like that, right? But that's led into it's gone through different waves now, and then in the third wave, where like acceptance commitment therapy would have fallen under like um, cognitive behavioral. They have like tons of other ones like process based therapy has evolved, and process based is many meaning to be like actually the overarching thing, which anything could fit under. But then you have like dialectical behavioral therapy. There's compassion focused therapies now. Just like a bunch of different ones. It's a whole rabbit hole that like I can't get fully into because I'm not like fully in that culture. But what has evolved from that original idea was that, maybe it's not that we need to be replacing these thoughts, behaviors, and cognitions, and that maybe there are some aspects of those things that exist on a spectrum, right? That if everybody kind of experiences these things, then maybe that's just a normal part of the human condition, and we need to figure out how to take away what is useful of those things and learn how to not necessarily tune out the noise, but like work with that extra noise that our bodies and our minds like to give us.
I see. So rather than trying to push those thoughts and feelings way down and ignore them, let's talk about them, see what we can do with them, maybe make them constructive. And from them, understanding PBT is not necessarily a specific process, but it's a
Mhm.
multitude of different ways to look at how to treat a specific patient or
Yeah,
something they're experiencing.
yeah. So like within that, you may find that like certain things work really well for that individual. So it's all predicated on that if you can use at the end of the day some kind of evolutionary reasoning to why what you're doing may be useful, like there was a process that selected for it, there was maybe some pressure that resulted in that process being around, we have maybe some good evidence across multiple domains that say like this is an actual thing rather than like allowing, because the problem is once you get to be more cutting edge, it's hard to distinguish like what is truly like grounded in good science and more factual, and what is maybe pseudosciency like BS. Um, right. So what they're saying is like, okay, everybody can have a place at the table, but you have to kind of, you know, put up or shut up, because if this doesn't have some kind of sound foundation for it, then we probably shouldn't be using it because it may not be effective yet or worthwhile, right? So what Stephen Hayes says, who's one of the like people that's pushing this, he said like if you continue to ask your cardiologist, like you go in and you see them and you ask continuously like why is whatever, like why, he goes eventually you're going to get through some questions, they're going to say, well, we evolved that way. And that's essentially what they're looking for, is like if you can at the end of it say, well, we evolved for this to be a thing, then that's what we want to continue with. And then with that, you would see that anything that is considered like a named therapy type could be beneficial within that, as long as it leads to a successful outcome, a good working for that individual you're using it for, and gets you towards where you're wanting to be at the end of the day. So that way it's less dogmatic, it's more flexible, and it's meant to really just give you a way as a clinician um, to hopefully organize the chaos a little bit better.
It's more so a way to look at treating patients, and it's still very much based in science, but
Yeah.
the approach is just a little different. It's more of a individualized approach, but looking at the person as a whole and trying to help them more maybe with a lifestyle change or something like that.
Mhm. Yeah. And like it can be even like kind of simple examples of like a process based approach would even be like the best way I know to explain it right now would be like in like powerlifting examples or like even bodybuilding. Whereas like you could put together what is theoretically like the greatest program in the world, right, for somebody, but and could give it to like 10 people, but maybe for those 10 people, it only ends up being like the best program for one of them because of individual variation. They work different jobs or have different enjoyment out of different like lengths of programs, or maybe one of them's had like children recently, like has a newborn, so like maybe they can't actually finish the whole program, or maybe there's some accessory lifts in it that they don't like as much, or have a higher recovery cost for them, or say you're asking them to all execute like a lift the exact same way, like oh you have to do like um like saying squatting, or they have to you're like oh you have to do high bar with a narrow stance, and you have to do your deadlifts sumo in this particular fashion. Like, well, we know that that's not going to be the best lead to the best outcome for every individual. It may help a lot of people, but it may not maximize that um, benefit for every single person.
Yeah, and I feel like that's so much of what studies are is searching for this, especially in physical exercise and things like that, is we're always looking for this optimal way of living, this optimal program. But that doesn't really exist, not only because we're all different and we have different goals in life, but also because there is no real optimal way to live. Things happen in life that may change that. And for someone who has this program that's like the best program ever, well, maybe for someone like me who wants to do a little more cardio, yeah, maybe this is great for powerlifting and, gaining strength, but maybe it's a little too much, for maybe what my goals are or something like that. So I think that's
Yeah,
something to consider too, is truth is too, if there was one optimal program, then we would all have the same coach, right? We
yeah,
would all
yep,
just we'd all be the same people as well. I don't think there would be any individualized approach. Also, I think breeds that kind of individualism as well in the person that you are and what your goals are.
yeah. And what's important to you, like whether your values as an individual, like things that you care about or your deepest desires.
So oftentimes in sports related pain, and when you're talking about things that relate to pain, especially in powerlifting or weightlifting, there's this idea that there's this ideal form. Like you kind of touched on this with like having someone do high bar squat and then like really narrow stance. So how important is form for, let's say, like an athlete versus a lay person, or is it really that much different?
So the interesting thing is that it really just gets into like what it is that you want to accomplish. Like playing any sport or things like that, it's all kind of arbitrary. Like the basic idea, like fundamentally, it's just that like humans don't like that the world is chaotic. And we can kind of see this like evolutionarily wise, like not to say like if you are religious or anything that there's anything wrong with that, but you can kind of see like that's probably also one of the reasons why like cognitively every culture develops religion in some form or fashion, is that there's always going to be things that are unanswerable, at least currently, like that we won't find the answers out to until like you know years and years from now. Like, I mean, it used to be that people would believe that a volcanic eruption was because like a god was angry at them, and didn't understand like, that you can see certain patterns of geological activity that shows you like, oh, well, this is more of like an active volcano or whatever. Like, understand that there's shifting tectonic plates that result in earthquakes or, weather patterns or whatever it is, right? So there's always going to be things that we don't understand. So as we have sports or whatever it is, there's this idea that like there's a certain way to accomplish said sport, but that's largely because of the rules of whatever that game is. Is there a perfect way to do it? Not necessarily. Like there may be in powerlifting say there may be just more an efficient way to do certain things. Very high level performers may have a slight variation on their technique that actually others can learn from and maybe then emulate and perform very well. But we see that evolution with other things too, like with basketball, right? There's the way that people play basketball now is very different than how it was played at the outset of it. Like you probably take certain average players um, from like today, and if you put them on a court, like back when basketball was first founded or became like a professional league, they would probably run circles around people because they'd be like, "Oh my God, like I didn't even know you could do these things." Um, like the invention of the forward pass in football or like the usage of it today, you didn't see back in, like the 70s, um, quarterbacks throwing for like 5,000 yards. When it comes to form, it's just like, well, what's the function that it serves? So does for powerlifting, it's going to be what allows you to move the most weight from point A to B the most reliably over the longest period of time so that you can become the strongest possible for you individually, right? And that could look very different for some people. And maybe with bodybuilding, it's going to be what probably puts the most stress on a muscle that results in its growth that you can sustainably then do for a long period of time. Like, um, say, like if we look at current emerging evidence, like long muscle length training with most muscle groups now is seeming to be more beneficial. Like that, you can even get with partial range of motion just as much stimulus as you would with full range of motion. In some instances, this has been seen. Like even there were individual studies. Like the one that stands out the most to me was they had a group do, and I believe it was between their arms, right? Like one arm they did like a preacher curl, and the other arm they did an incline curl. And what they found was at the end of the study that the arm that they did incline curls on actually experienced 3 times as much growth of their bicep than the side that did the preacher curl. So it just goes to show, like, yeah, they still grew, but like it was much more effective. And there's ways that we're doing certain things now that like people may have thought of or showed. Like Arnold actually had a lot of things, like Arnold Schwarzenegger back in the day, that actually turned out to be like very beneficial that now science is catching up to say like study because people actually care about it now to study it that hey yeah maybe they were onto something here um, but you still get these people that go oh no you have to do things this way right because of these reasons and we have a hard time letting go of those traditional things like a lot of our ideas about what would cause injury for example is one of those things but there's a big wave that I'm lucky enough to be a part of and seen as being one of the people that's pushing is movement optimism that we're seeing just these astounding things that people can do in different positions because we've now made it like we're like hey open your eyes there's like tons of ways that we can do things if your body can do it and you load it appropriately for you and have enough factors in your favor for recovery like you can probably do way more than you would think like Jefferson curls Zercher squats Zercher deadlifts um, I've seen which is not gonna kick myself for never remembering how to pronounce his name. But Alec Blennis is like a good example of he always posts tons of good videos. Coach Taryn, Taryn, Tarun. But his real name is Sam, I believe. But he posts a ton of stuff where he does like because he does Brazilian jiu-jitsu and different things. And he'll do like uh into flexion like with a kettlebell like twists like just side to side so he can do like spins and different things like that and those are things like before that like people have been like oh my god you're going to wear out your spine or like even as much as I don't like the end product of what knees over toes guy like stands for because he ends up it started well and good and then became a lot out of control, just like certain other platforms have with like Huberman and different people like that, where, it was like, hey, your knees can go out over your toes and they're not going to explode. And some of these ideas even come from very antiquated things that like Iron Culture had a podcast where they talked just in length about like why people think or thought for the longest time like squatting wasn't good for your knees. And it all went back to this study done in Texas. I think it was like a University of Texas, where they put a brace on their knees while they were squatting, and at certain depths found that the like pressure inside the joint increased more at certain depths. So they just immediately were like, "Oh, yep, that's it. That means it's got to be bad for you." But then, like, unless we take these things and extrapolate them out and then actually study them for long periods of time, we don't know if that's actually good or bad. Like, typically, the way that our body adapts, like the way you maintain bone is by putting physical stress on your bone, and then that gives a mechanical signal that gets turned into a nerve stimulus that then triggers your endocrine system to say, hey, we need to actually take calcium out of your bloodstream and put it onto your bone because we're getting a sufficient stimulus that says we need to maintain this mineral density there. But if you don't stress your bones and your muscles and things, then they actually break down and you lose bone density and you have trouble. So a lot of times the problem is we're taking these short snippets of things that we think because we think very mechanistically again, that because of this, that must mean that this is going to result in this thing. And then evolutionarily again, we're wired to be more negative. Like that's why we tend to beat ourselves up mentally. That's why we tend to be more conservative, cautious, things like that. Because, for thousands and thousands of years, if let's just make up an example, if cavemen were squatting and um, you know Bill over there squatting and his knees come together and he tore his quad while he was doing that or whatever, right? Or hurt his knee and then had a problem with mobility, we're going to be like, oh, maybe we shouldn't do that too. And that's just how our brains work. We're really good at taking weak correlations that may not have any actual sound foundations or merit and extrapolating them and holding on to them. But that's because we're wired that way. But when we objectively look at things, we can adapt to a lot more. It just, what function does it serve? And if somebody just wants to do it because they're a layperson or maybe their sport, they have to get in this position. There's no reason why you couldn't do something. I know I do some stuff with patients. I commented on one of Sam's posts and like I've commented on a couple of Alex ones, and I was like, yeah, you should see the reactions that some of my coworkers give to things that I have patients do.
That's all very interesting stuff that we got to talk a little bit more about. I find it very interesting with the the idea of that everything's a religion, right? That all this stuff that we see is a religion, and I feel like that's very much the case, especially with powerlifting. I'm going to use that as an example again, just because you and I are both familiar with it.
Yeah.
But on the outside, people look at it, powerlifting, for people who are listening don't know what that is squat, bench, and deadlift. And a lot of times, I know you mentioned squat has always been seen as
Mhm.
kind of a problem, but I hear a lot that deadlift, oh, don't deadlift or you'll hurt your back. If you
Yep.
round your back at all, you're going to break your spine. And, I've definitely deadlifted a few times with the back that's probably been slightly rounded, but my
Mhm.
back is still intact so far. But that's sort of that like, uh, where everybody agrees that this is just a problem and this is how things are. And it's
Yeah.
kind of like that religious presumption. Not saying that religion is bad, just saying that it
Yeah.
is an already predetermined idea. And
Yep.
even within the sport of powerlifting, again, for people who are listening and don't know, there are two ways that you can deadlift in the sport of powerlifting with conventional and sumo. Conventional is where you're standing more upright, your legs are standing closer together, And then sumo is where your legs are more spread out and you're trying to engage still similar muscle groups, but a little bit different. It all depends kind of on your body mechanics. So I've done both, and I'm sure you might have done both as well. But there's this kind of stigma in the community a little bit, or people who are not very familiar with powerlifting, that sumo is kind of cheating because it looks like obviously, you might have a different range of motion or something like that, but it's kind of seen as like cheating. And that's also another one of those almost religious presumptions that comes up oftentimes in this sport. When you talk about doing things and not doing things for the benefits or the consequences, I think it's very interesting that you mentioned this idea that when we don't use these muscles and we just continue to say sit around or whatever, our bodies are actually breaking down. So we're not helping ourselves. I mean, obviously, if you have an injury and you have to rest, that's different. But when you don't do something for out of the fear that you might hurt yourself, you're actually hurting yourself by not doing that, right? Because I know
Yeah.
I've seen uh, graphs and charts showing bone density over a lifespan. And when you eat and the correct amount of calcium and you're getting all these nutrients in your body plus exercising, when you look at those charts that map out bone density over a lifetime, you can see that the person who has been doing those things is most likely going to have higher bone density over their lifespan. And I feel that's very interesting too when we talk about all these things that, oh, if we do them now, we're going to pay for them later in life. When in reality, if you start squatting and start exercising or doing whatever it is that you enjoy, sure, you may have some pains and injuries down the road, but maybe you do have more dense bones. I can't say that for certain because I'm not a physical therapist or anything, but I think that is interesting to mention that it's not always the opposite, but in this case, it kind of is from what our
Yeah.
perception is.
Well, and even like the American College of Sports Medicine and World Health Organization is actually pushing in their guidelines now more resistance training. They've gotten rid of flexibility as a key like component, and now they're largely looking at just aerobic and strength training, because the largest preventable issues in the world, for like causes of death in industrialized countries, other than things I won't mention to not get too political in this podcast, but for older people is heart disease, diabetes, and the like, and reduced more mobility and muscle bulk actually is a large issue, that leads to those being problems. Like sarcopenia, so muscle loss, as well as bone density loss over your lifespan, just like put you at such much higher risk for having issues that would like reduce more uh, your longevity, and robustness, that like we're seeing like, yeah, really using your body does make a difference, as well as like, there's also potential reduction in risk of like the five most common types of cancer from in those that are more active than not. And recreational runners actually have one of the lowest instances of problematic arthritis, where like there's something like less than 10% of them. And out of them, like they tend to have the least amount of joint replacements. Um, and I wonder too with like our age group, if like the style of powerlifting and bodybuilding that we're doing will also be maybe more beneficial, just because I think in the 80s and 70s what you would see, it was like it's still niche things, but like more people are getting involved in the gym. And also because it was so niche before, there were also other substances more widely used, which would obviously put you at greater health risk for certain things. And I think that's also where you see that more of that wear and tear come from, because like how they were doing things and the approaches may have been more extreme already. So you see more extreme end products.
Yeah, I see what you're saying with the idea that how we move over time has changed a little bit too, and our understanding. And maybe there is some benefit to doing things a little differently. But again, that all comes down to body mechanics as well and what you personally want to do. I mean, there's still plenty of people who take steroids today, I'm sure, but
Mhm.
sorry, I'm not sure if I'm allowed to say that word, but performance enhancements of any kind. But there is definitely more people probably who don't feel they have to fall in a certain category to go into the gym and do something, uh, to do it recreationally as well. There's a lot of more involvement maybe with sports, especially in other groups as well, like with women and other people who maybe before didn't really feel comfortable in these places. And I think that is one of the benefits of kind of seeing this in a more scientific light rather than just, you know, saying that, oh, I want to get big muscles and compete. You can look at it from the perspective of this is good for the general health of the population. And that is one thing that I really do like about the science of kind of physical therapy and sports and exercise science is that it all kind of shows that it doesn't really matter who you are. You really should be active and enjoying your life and enhancing your life. I guess you could say your health span, increasing your health span.
So on your point, I was gonna bring up even like because like culturally we bring up too like not just the wear and tear, but like people talk about metabolism, right? And they're like, oh, once you get past like this age, whether it's 30, 40, 50, whatever it is, like, oh, your metabolism's gonna slow down. But then people don't consider because we talk about like psychosocial, like what are other things are going on in our life during those time periods in which like maybe it means that your pattern of eating or activity levels or things like that may change significantly. Could be responsible for sleep patterns, stuff like that, responsible for changes in your metabolic function, hormonal health, all those sorts of things because also the dirty little secret is that activity probably only really regulates mostly like how our metabolic hormone signaling and different things like that works is why it helps because really like intensive training doesn't burn a lot of calories unless like you're a pro athlete or somebody who's like super active and there's also different types of metabolism which coincidentally, I think probably more people have evolved that I think it's like a thrifty metabolism. Stronger by Science has done a good breakdown of that where Greg like went through the different types because evolutionarily that makes sense. Like when you are using more energy your body's going to find a way to become more efficient more easily. And when you're in scarcity for food, your body's also going to figure out a way to slow down your metabolism so you don't need as much, which is evolutionarily like makes sense. Like your body would want to do that more often than not. And the people that could do that would probably survive more to be able to pass on their genetics. But Herman Poncer in his group used the open data set on doubly labeled water. For those who don't know what that is, it's where they take water, you can adjust the weight of the isotope of it chemically so that then when somebody breathes out, because our metabolism, like the best way to measure metabolism is through expiration, because carbon dioxide and things like that, that's how you metabolize your uh, body fat. It's actually, you can measure it through your respiration. And so they give you a card and they'll measure that. And they had an open data set of like thousands of participants from the lifespan, like from kids to pregnant women to men, women, all the way up to older age populations. And what they found was that between the ages of 20 and 65, metabolism like almost like does nothing, like it stays the same. But like if you tell people that, and this is like one of the best uses of open and free science in the entire world with like one of the largest data sets. It's one of the best projects ever done using like rigorous methods. People are like, oh, I don't believe that because of their anecdotal experiences. But we know that's the case. So, it gets into that whole other aspects like we were talking about, the, religion almost like when something becomes so ingrained.
Yeah, when everybody has sort of this consensus of agreement, even whether or not there's scientific reasoning for it, it does very much become like a religion in the way that things are passed down, or a tradition. I feel bad for saying the word religion because,
Yeah,
I don't want people to feel bad for following a religion because there's no reason to. That's not the point of
yeah,
this. But it is to bring light to something that is kind of pre-assumed
yeah,
for and is just passed down almost like genetics, right? Because you talk about things like, oh, this, like you mentioned earlier, my fellow caveman Bill tore his quad, and now I shouldn't squat. And then for the next 20 generations, no one squats because their parents and their parents tell them don't squat because this happened, blah blah blah. And then eventually you just lose the reasoning as to why. Um, However, speaking on this same topic of a group agreement and these assumptions that we have based off of movements that we should do and should not do, this also follows very well into the psychosocial models of pain. So there are two kind of psychosocial models of pain that I am familiar with, and I was curious what the differences between them are and how you would help people who fall into this category or help patients in your own practice. And they are the FAM, the fear avoidance model, and I believe the other is AEM, which is the avoidance endurance model.
yeah. I mean, people fall into all sorts of different subgroups, but a lot of people have difficulty with experiential avoidance and kind of having room to expand to make space for discomfort to exist. Like that's just something natural, and you can see it too in like Western society, and actually with the decline in religious practices and things like that and just like current marketing, since the 50s, like Mad Men, it's like how everything is about how do we address a pain point for people. And a lot of that is inconvenience, discomfort, things like that, right? There's always like some pill or some device or something to get us to avoid pain or having to experience certain types of distress or inconveniences. So like it's fairly well ingrained in like our um, cultural stuff now because of how like Mad Men culture affected marketing and what we're seeing on TV all the time, especially here in the West. But it is funny too, like when you look at issues like opiates, it was in the show Dope Sick, like when Purdue marketed to the Germans to try and get like specifically like pain as like a more prominent like indicator for medical. They were kind of like laughed at them, and they're like, yeah, we don't really care about like that. Where like people get better, and they didn't care put as much like emphasis on like pain. So that was kind of like funny. That it shows like there how your cultural stigmas can potentially influence how you may manage like people in pain. They're just like, yeah, people are in pain, whatever. Um, so you can see like with certain teachings, like even with like science has looked at and some of the ideas of like addressing like fear avoidance models where like we hold on to and there's a lot of complexities as far as like evolution, biological, physiological, psychological, social support, like how all that influences these behaviors and factors is that if we're fearful, we tend to be avoidant of doing things, and then it's just a cycle of like more pain, more distress, potentially catastrophizing, and then more pain and loss of ability, endurance, things like that. Um, where it leads into like a negative cycle. And the endurance model looks at that sometimes people actually behave differently. They may still, in the face of these symptoms or distress, actually persist and view it as like a eustress. So, like, I look at that with like powerlifting, like, heavy lifting, high repetition training, like there's different aspects, even like running, like this good distance running or cycling or whatever sport participation. A lot of that stuff like kind of sucks while you're in it, but you actually learn over time that to associate it more with like a benefit, a positive. So people may then persist with those things and reap like benefits from it. In the same way that you can see in history too, like people are probably pretty good at dealing with a lot of aspects of distress because also you would like for a lot of religious practices and things like you would purposely like put yourself in uncomfortable situations. Like, think of like because Ash Wednesday was recently, so it means like Lent is coming up. Like Lent, you purposefully give up something that would um like brings you enjoyment or whatever and causes like a specific stress for you now. In the Islamic faith, there's a time period in which um, is Ramadan, you fast all day. So you're purposely putting yourself under this like kind of stress. So it would be interesting to see if there's maybe some studies that show maybe people that are still more religious in this day and age actually follow more of that AEM model because they're kind of conditioned better to handle distress and like sit with those discomforts and things like that and see how that could reward them because it actually does go against our biology and evolution and then cultural aspects now too where a lot of people now are potentially being shifted more to that fear avoidance style and then we're seeing like higher surges and persistent pain and symptoms and even like diagnostic labeling sometimes doesn't help. Different things that we're doing and ways we're approaching things sometimes are actually encouraging fear-based learning more than actually helping them maybe understand that maybe sometimes these like pains, uncomfortable thoughts, sensations, emotions, different things are part of the human experience and can be worked with and through to still have like good quality of life or different things like that. And that's one of those things, even like in the past, because of their technologies and different things not being as good, they just had to cope with. Versus today, we're shaped a little bit by that social aspect. There's a name for that, and I forget what it is. But we talk about it in my fellowship, and I actually had a post recently where I made fun of that because like we talk about like text neck has become like a thing, um, or they some people call it tech neck and back, right? But like people have for a long time been in the same kind of postures and positions. Like even since like the Victorian era, like people have read newspapers at like dinner tables and breakfast tables and like would, instead it used to be common that if people were waiting somewhere, you'd bring a book with you. And you'd sit and you'd read your book with like your head bent down. Or like calligraphy, I mean, any of the ancient languages, like you had to bend, like stoop over to do those things. So like, why don't we hear about those kind of, oh, I have calligraphy neck. I'm sorry, I have to do less writing.
Yeah, those kids and their damn calligraphy, right? Mm.
Yeah, I mean,
It's interesting you mentioned earlier about how there was culturally different people may look at ailments in a different way. So without pain, without a lesser consideration of pain. And I feel that's
mm,
very important to mention is that pain is part of the human experience. It is something that we're going to experience. And obviously you'll want to see a medical professional if there is something wrong with you, but it's not always a clear indication of something, and it is just part of who we are, and it
yeah,
may mean different things for different people. And now, a quick word from our sponsor. As a martial artist, our philosophy and way of life goes beyond the walls of where we train. As an artist of life, self expression is the name of the game. What better way to express your style than with streetwear that tells others who's in town? Master artist and calligrapher Yasuko, owner of Dragon Ika Calligraphy Art, has everything you need. Whether it's hand painted calligraphy shirts, custom made Japanese calligraphy necklaces, artistic drinkware, or seasonal specials, Dragon Ika has everything you need to express your appreciation for life and art. Support your local business and check out Dragon Ika Calligraphy Art on Instagram at dragon underscore Ika, IKKA, or visit their website at www.dragonica.com. Use code NEWHUMAN10 to get 10% off all merchandise. And now back to the show. So, what are some basic ways in which we can physically overcome pain?
Yeah, so physically, I mean, a lot of it is just knowing that, like, as you continue to move within what you're able to do, on average, most musculoskeletal issue, right? I say most, not all, will get better in time. Most of them are what's called self-limiting. So they limit your function enough that it gives time for, like, if there is tissue damage, for it to heal, and then your body will typically be oversensitized, so it won't allow you to necessarily do things that would then necessarily cause you more damage. So that way that tissue can heal. And then as it gets more and more capacity, you'll be able to do more and more. Um, just moving a little bit often if needing, like, go see physio, chiro, whatever it is, right? In your area, because we're thinking of all around the world. Um, those things can be useful, and just as best as you can engaging with, like, whatever your normal activities are, making sure your recovery is adequate. It means, like, recovery, I mean, like, sleeping, like you're getting adequate amount of sleep, doing whatever you can potentially if needed to reduce other stressors, or finding ways to maybe mentally cope with those stressors, and then you're eating enough, staying hydrated, like have proper nutrition. Those are really the best ways.
And oftentimes, in general terms, we have this idea that our bodies are very fragile, that we have to avoid activities when we're in pain. And as we get older, we develop this notion that, oh, our bodies are breaking down, or it's almost like a car that has 100,000 miles on it, or a rusty machine. That's how we see ourselves.
Mm.
Uh, as a coach and as a physical therapist, what is this like in your experience? Is this really what happens? Or, I mean, I'm sure our bodies break down and are a little bit more difficult to deal with over time. But to your knowledge, what is the true resilience of the human body? What are some examples of that?
Yeah, I mean, like, for the most part, it's not true. I mean, there's other factors that always influence it, right? That's why, like, it's so individualistic. And, like, I tend to then see the people who maybe have more of that lived experience because of, like, whatever else is going on in their life that has resulted in these factors becoming prevalent, versus, like, the people that are probably much better off, I don't see, because they've, had all the other factors that were in their favor. So it's hard because, like, in the clinic, I see the opposite, and then it's harder to get to those people and tell them, like, be like, oh, well, this isn't like everybody's experience. Um, because if that were true, then, like, you know, if cars actually behaved like our bodies, like, your tires would get bigger the more you drove with them, not smaller. So, like, you can push it, but it's like everything has to be within what is within your capacity at first, and then you can grade up usually. The only thing that this hasn't been true yet with, it's still emerging, is, like, long COVID. It seems that there's some kind of inflammatory reaction or response that, like, with more intense and graded exercise, it can in some instances lead to more, like, breakdown, because, like, the normal inflammatory processes that would result in, like, tissue healing and adaptation, like, to trigger that response, would actually it actually seems to be counteractive. So in that way, it is acting more like people with, like, our cultural perspective is.
So, are there any ways that you try to help people mentally overcome pain? I know this might relate more to the PBT based stuff that you talked about earlier. How do you, as a clinician, how do you try to help people mentally overcome pain?
Yeah. So, like, the biggest ones, like, even if we look at, so, like, physically, what we're looking at is, like, movement and positioning. Is there positioning or movement that works better for them? And typically that involves, like, incorporating some kind of variability again in, like, how they might move or position. Like, the reason why we roll around at night is because if you stay in one position long enough, your blood supply can be insufficient to an area, And over time, that would lead to breakdown, but your body senses that and you move, right? So the same thing when how we're moving too. We need to have sufficient variability in that movement. You can improve like loading capacity. So maybe like watching how somebody's move and see like, is there a way that they can better distribute forces, so it's more effective, efficient, or tolerable at that time. And also improving characteristics like your strength, endurance, muscle mass, like things like that, and your tendons, cartilage, and stuff will adapt. And then on top of that, like general health behaviors, we're still talking about physical, but this then segues into the mental. Like, you're getting enough sleep, adequate calories, adequate nutrients. Like, if you have scurvy, like you're probably not going to recover well and you need some vitamin C. Um, but mentally also that negatively affects you because then your distress tolerance can be reduced if you're not getting enough sleep. Obviously, like other factors like blood pressure, heart rate, like things like that can be higher. I've had a patient recently who their mother lives in on the other side of the world, or lived and was sick and dying, and so they were up like all night at times, and the stress from that was causing them to develop like heart palpitations and like high blood pressure, which then affected their health. And we talked about how actually with back pain, it does seem that within the first year of having big distressing events, people are much more at risk for developing symptoms in that area because of how it affects your physical like tolerance and capacity for certain things. But then we can also look at, it just depends on where that person is getting stuck. So what I've gone through is like those are three of the nine processes that we kind of talk about. So movement and positioning, loading capacity, general behavior. Then you can see like there's attentional focus. So like somebody who's really being stuck in the past of like how things used to be, or past experiences, or different things, or also like worried and conflicted about what's going on in the future. So like we may work with them to help be more present, like in the moment, right? Like it's not bad to at times think about your past or the future, but like for that person, it's causing them to become stuck and not able to progress or get fulfillment out of what they're doing at the time. Or which actually I had somebody the other day that we've helped them with other aspects of the mental strategy, but then now they're having a hard time being like present and like getting enjoyment out of what they're doing. Like so much even too in our Western cultures, we do that with say like eating, right? Versus like in some cultures, like I know in France is a good one example of, and then like in Islamic countries, like they, for example, don't. One of the reasons why you see a lot of those cultures also still eat with their hands or like flatbreads and stuff is actually in this like Islam, it's a doctrine to be like mindful and present while you're eating, according to Muhammad. So they don't eat as much with utensils. Actually, like that's a long story of like why they don't. So like, and when you're more mindful about being present and enjoying what you're doing and focused, then actually that leads to more enjoyment, fulfillment. Um, but if all you can think about is like, how was I before this injury, before this pain started, or what are things going to be like in the future, then you're not actually able to commit to enjoying what is like your values or who you want to be or achieve goals that you have, right? And then cognitively, we can look at, are they being, is there a dimension of like fusion? So fusion is like essentially you just taking what your body and mind is telling you and seeing that for being the truth now. Like we have to have some fusion, right? Otherwise, like if didn't have any fusion to like say deadlines or dates, then I wouldn't have gotten on when you or been ready for when we agreed that we were going to meet for this today, right? If I'm getting stuck with those things like that, pain means that, say, for example, like I'm causing damage. Well, then with that person, we may be able to actually go through experiential learning. With typically with pain, it may be me having them do some kind of like activity and set it up for success where like either their pain doesn't change at all or even could potentially diminish from that. To reduce that fusion of like pain must mean that there's damage. Or like have them, I've had people do like say take their body part, move it around in a certain way and go, okay, like this is your motion you have now, this, and this, and then we go through and do something and then have them check that again and go, okay, well, did that change in any way? But your pain is still the same. Or like I've had them do like movement experience where like, oh, it's easier to do this. And I go, yeah, but what's your pain level? Well, like, what's your pain level now? And their pain level is usually the same. And I'm like, so like, doesn't that mean that like pain isn't necessarily indicating that you damage yourself? You can still do something, but you don't have to be stuck with it as like, oh, that's what that means. There's other experiences too I've had people do is like putting their hands over their face and like saying like when you're just letting pain be so prominent, it's not allowing you to interact and engage, and that's being fused with it or hooked by it. And like we can fight with it and push it away, but that still doesn't allow us to necessarily engage with activities. Versus if we can let things sit for a little bit, then we're typically better able to um, cope with that. And then we can look at emotional. So if they're experientially avoidant, helping them become more engaged with activities again. Do they have a hard time with conceptualizing who they are, what their values are? They have a lack of ability to, are there problems with their social life or support, or do they need help like with job training, like different things like that?
I see. So it's very much a all around approach to
Yeah.
looking at their pain, seeing where it stems from. And the there is a common word that's associated with kind of this idea
Mm-hmm.
that we overreact or we look in the past or look in the
Mm-hmm.
future to kind of understand where we're at now. And it's this idea of catastrophizing maybe how bad our pain is now. And if we continue to exercise or do whatever, that it may just worsen and that we need to
Yeah.
stop doing this. And I think that's a very important point to mention as well is this idea of catastrophizing, making things seem bigger than they are. And
Mm-hmm.
I was just curious in your experience how common that is, how common you see this kind of almost, it almost seems like hopelessness when you run into these pains and things like that.
Yeah. So catastrophizing, like that's very common to see. I wouldn't say I have to deal with it with like everybody from a mental perspective, because a lot of times like through experiential like activities and like them just like initiating the process of like coming in and getting a little bit of reassurance and things like that, you do see where like people will start to notice that maybe like the worst things that they were thinking are not true, or they're able to make some progress or start to feel like better. Um, so then those things reduce, but there still is like aspects of that in some people where then I will use like techniques that I've learned from going through specific coursework on like psychological flexibility. What is traditionally looked at as like acceptance commitment therapy like techniques, which actually overlaps a bit with like CBT and stuff like that. It's just easier for ACT, I think, for non-psych professionals or psych or social workers to learn, from what I have understood, because like World Health Organization, for example, uses ACT heavy like resources, because of how easy it was to put in very plain language and to in that same language be translated into like 21 different languages. They have a resource that's called Doing What Matters in Times of Stress that's available for free. And they've used that with refugees, like from Ukraine, or people who were displaced, or just different groups of people all over the world. And they found that it had a significant effect on like levels of PTSD, well, reported distress with PTSD, depression, anxiety, like all those things. Because one of the problems we see with how these things are being studied as well is that like they'll look at specifically maybe just pain and pain levels, right? Or like these objective measures to like look at like um, depression and things like that. And the problem is that like that traditional third wave now may not look at actually reducing that those things are present or exist, but then how are you functioning even with these things? So you may see like a long-term intervention that we do through like reducing catastrophizing may not actually change what their pain is, but how they then engage with their pain and choose to engage with the world around them or things that they find is in alignment with what their values are, like who they want to be as a person, may be much more succinct and things like a 0 to 10 pain scale wouldn't appropriately capture that. And even like traditional measures of like function that we use in physical therapy may not reflect that, but they might actually have improved quality of life. Um, in a lot of times it's just addressing that with experiential learning, education, and then it depends on what aspect of catastrophizing they're having the most time with. Like, are they more fused? Are they having more trouble being present? Do they have a hard time with committed action, or do they not even know what their values are? Do they have trouble making space for distress to exist and still see that they don't have to necessarily um, um, so it's not necessarily like they used to use the term acceptance, and that's gone out of favor because acceptance sometimes gives the like illusion that you're telling somebody they have to just resign to like having whatever their symptoms are constantly all the time. And what they've replaced it with is expansion. And what that means is like you're kind of just giving space for it to exist, just like how if you could think of it as a physical metaphor, you know, like I might have an apartment bedroom, say, and I could say want to have a king size bed, but if that room isn't big enough, then I can't fit that bed in there. So it's kind of like you're making that space for that thing to exist and still have functionality.
Yes, I see what you're saying. Rather than just letting it control your life, give it a space and time sort of in your life that you can experience those things, but still not change who you are.
Yeah.
Um, I think it's very interesting in talking to you before we go that you try to implement a lot of mindfulness and this idea of self-efficacy of not just treating people, but actually getting them to a point where they can kind of take over,
Mm,
not necessarily treating themselves, but dealing with these things in their lives rather
yeah.
than just saying, here's a pill, and of course, everybody is going to take pain medication or anti-inflammatory drugs at some point, maybe in their lives for different things. But
Yeah.
I find it very interesting that you use mindfulness and mental help as well in developing ways to help people overcome these things themselves.
Yeah. Has like long standing roots in different areas too, especially like in Eastern religions and different things like Buddhism and other similar religions, but also like Stoicism in the West, Roman Stoicism. Marcus Aurelius is one of the most well-known Stoics, where you're figuring out how to take what is there that is good and tell that negative, like understand that those negative parts exist and that we don't necessarily always have to listen to those negative aspects. Like there may be times where those are beneficial, right? Like I should be a little bit wary when I go up to the a street and like to cross a street look both ways. Or if a dog is barking at me and foaming at the mouth, maybe I don't go up to it and go, "Oh, hey, nice doggy, let me pet you," kind of thing, because that's gonna result in you getting bit or whatever, right? And there are times where pain is going to help you, and there's times where relief is okay, where you can take medicine or whatever it is, or to get some relief. But there are times where you do still just have to learn how to manage with the stress and how to sit with it and how to know when um, that thing is going to not allow you to be the person that you ultimately want to be. And how can we get moving in that right direction again? Especially one of the things that a lot of people like when they first see me is that I think there's a probably a cultural thing that whenever you go see anybody for pain, they're like, oh, I'm gonna have to like stop doing blah blah blah. And I get some people that just like this wash of relief over them when I go, whoa, what do you like to do? And then they tell me like things they like to do. Maybe they really enjoy something like some kind of like working out or activity. And then I go, well, like tell me more about that, symptoms. And then maybe it's like something that it doesn't even affect them, or like there's an aspect of it that I can immediately have them re-engage with because it's not going to affect them in a way that I think is going to lead to us like not ultimately getting back to where they want to be. And they're just like, oh my goodness, like I thought you were going to tell me I had to like stop doing that.
I might have to have you back on this podcast later to talk about stoicism or some philosophy. And this is a philosophy podcast as well.
Yeah, it is. It's funny too because I noticed like apparently there's some people that like complain about mindfulness, having some issues with like that they've taken it and medicalized it and taken it out of like say Buddhism and stuff like that, and just like maybe not paying the due diligence, but then and like westernizing it. But I'm like also like Stoicism exists, and when you like look at some of the teachings, if you're not like dogmatic about it, you can see how they like align very similarly and they developed independent of each other.
Yeah, it's very much up to interpretation, and I feel like sometimes stoicism gets interpreted slightly different than what it was meant to be, but
Yes.
that can be that can be a topic for another podcast in the future, which I'm sure we'll have.
That's my big thing with like Berserk. Whenever I talk about Berserk and say that I'm like a huge Berserk fan, is that people then typically then only associate you with like the negative people that are associated with Berserk, like the what's traditionally formed as like toxic masculine people. I would almost say like Griffith apologists would be under that, where there's a lot of bad things you could take away, but if you understand and look a little deeper, it's got some good messaging.
Agreed. Well, I thank you for coming on the podcast for the first episode. I really appreciate all your insight. Today's guest was Dr. Jacob Templar, a doctor in physical therapy and a strength and rehab coach. If you would like to learn more about today's topic, please visit at strengthandevidence_physio on Instagram. For coaching or injury management coaching, visit atpperformancellc.com. For more philosophy, self-help, health, and historical content, tune in here once a month to Spotify or wherever you get your podcasts. Follow us here and on Instagram at TNHP_podcast. I am your host, Michael Swigert, and I thank you for joining me today on the very first episode of the New Human Project podcast.